Everybody, getting our educational video out for the day. Wanted to talk today about the dreaded sciatica. There's so much wrong with just that generic diagnosis of sciatica, and so many people just try to make all their symptoms relate to sciatica. So I want to give a little more information about what's really going on so you can be better informed and better educated. So anytime anyone gets any pain in their back, their hip, down their leg, into their foot, in the calf, and even when they get it in the front part of the leg, they get diagnosed with what's called sciatica. Sciatica doesn't tell us anything. It just tells us that there's something wrong with the back of the leg. We get into this idea with insurance companies where we have to have a diagnosis for procedures to be covered. So sciatica casts out this huge net that there's a lot of things going on. But the problem is a lot of people get unnecessary treatment, surgeries, and rehab that they don't even need. So a lot of people try to think that all the sciatica problems is coming directly from the back. They think if the discs are bad or degenerated, they're causing all the pain that you're having down your leg, into your hamstring, and even to your foot. But a more common area that gets completely underlooked, if you can zoom in on this, there's a really deep muscle in here under number 28. That muscle is actually called the superior gemellus. And what happens is the sciatic nerve has contact with that nerve for about 80%. And that muscle tends to get stuck to the sciatic nerve and can actually give you a lot of symptoms in through there. So a lot of people end up having injections in their back, surgery and everything like that, but the problem is actually further down in the hip or caught through the hamstring. So we're gonna go over the whiteboard and talk a little bit more about what's going on. So what happens is you have that muscle that's perfectly situated down in your butt. And when we sit, you put that muscle in constant contraction. It gets overused. It doesn't get enough blood flow, doesn't get enough oxygen. And over time, it develops this glue. This glue is called adhesion. Now, when you have adhesion, it causes two big problems in the muscle. It makes the muscle weaker, and it makes it less flexible, which is bad enough. But the problem is your nerves actually have to pass way to get where they need to go. And it has to go through the muscles in your butt and down through your hamstring. And a lot of times it's getting compressed and compromised there, and it's giving you the symptoms of sciatica, the numbness, the aching, the burning, the tension. But what happens is doctors aren't able to fully figure out where that's coming from. They get you an MRI, they give you injections, they treat your back, but they're not able to functionally figure out what's going on. So a lot of time, money, and energy is wasted in treatments that aren't even getting to the specific thing. So there are doctors out there that are specialized in finding this adhesion and fixing it with their hands, and they can relieve symptoms of sciatica or back pain without having to cut you open or give you drugs. And that's a heck of a lot better option than what's going on today. So I want to give a little more information about sciatica. If you're dealing with it or you know someone that's dealing with it, tag them, send a message, or even share our posts, and continue our goal to get people out there and become better informed so they can get the right treatment for their problem. Have a good night.